schedule that are blocked off for testing only, and then I follow up with a video telemedicine visit with the patient about a week later. It's interesting. I would say, in a way, provide more space for sort of connecting and learning about them. So like Peggy, I block off a period of time where I do all of my telemedicine visits and I sit down, and there's no sort of, rushing, shuffling thing, people coming in, people coming out, people knocking on the door, sort of the chaos that's inherent to any clinic that we're all in. And the patient has to go, or their family member's lost, and there's all this, the things that we get used to in the hospital setting aren't there. And I block off 15 minutes for a patient, which I never sit down for 15 whole minutes with a patient in my clinic otherwise. And so I find that there is time to still have that connection with patients that I was worried I might lose. And they love getting the care that they require in a shorter period of time without having to wait in the waiting room. So I purposely screen the people who I think can be done with just imaging and then follow up on telemedicine. And a lot of those are glaucoma suspects or sort of benign problems and routine follow-ups. And so they're confident that this is a safe way to follow their care, and it means that they're often in and out in 20 minutes, and they don't have to wait for me to be rushing around and to sort of run in and see them. So I think they're also happy with that experience.
Yeah, I think that the screen share function has been tremendously successful. I think the patients really love it. Unlike in clinic where they're dilated, you've just shined a really bright light in their face for a couple of minutes, and they're trying to stare across a gap from their chair to a small monitor on the desk. Now you've got the image right on their handheld device, computer, iPad, or phone. I can control the zoom, the mag, the pan. I can put side by side images to last time. They're sitting there on the comfort of their own home, often having a coffee, sitting in their PJs, very leisurely. Or sometimes you have the business person who just schedules a 5 or 10 minute meeting in the middle of their day. It's much easier than them coming in to the office and kind of waiting in the regular queue. So I think the screen share has been tremendously helpful for imaging, and I can do most of the visit from an OCT and a fundus photo for most retina things. And it allows them to just, really focus on the imaging and the results and kind of how they're trending with the disease. So I found that it adds a lot more value to the visit as compared to some of the patients who have trouble getting on the Zoom or using the screen share where you're just speaking and trying to describe the images. I feel kind of bad, almost billing for a visit in those cases, because I just don't feel like I'm educating or showing or doing as much for the patient when I'm not reviewing the imaging directly with them. And I think the other piece that this sort of section was focused on the patient, but I think it's also like the patient family that this really impacts. And I've seen that it's very helpful for, a lot of these elderly patients. Their children take day off of work to bring them in. They often translate for some of the non-English speaking patients. So in that situation, we have a wide range of flexibility on the virtual visit time. So we allow them to do it really throughout the day and into the early evening. So the family member is often there and translating. I don't have to call an interpreter on the phone or have one scheduled for the clinic. They don't have to deal with paying for parking or sitting in traffic coming into Boston. So I think for a lot of practical reasons, as Encore mentioned, they've been doing it for several years. I think it just makes sense, and just took a pandemic for really this paradigm shift to happen. So I've seen a wide range of people that like it. It's all the way to my oldest patients in their 90s do well with it, even to the youngest patients that are really savvy with the technology. I've done some new patient referrals as well, where they might have had to wait a few weeks to get in for an appointment based on my next available. I could see them the next day as a virtual visit. So that's really expedited the care of those patients and maybe got them to their appropriate treatment earlier than would have otherwise happened. So I think that's been some of the biggest impacts.
It is increasingly clear that it's going to be a critical skill that you should graduate from an ophthalmology or any, frankly, residency training program within the next couple of years, of knowing how to perform telemedicine in your field. I think that is it's clearly going to be something that you should get practice in during your residency. As far as I know, there's not really any formal competencies for that or curricula for that nationally, but Grayson and I are working on one. And so we are hoping to think sort of more formally about all of the use cases for ophthalmology that have been discussed here, and thinking about not only once you've identified the patients that can be treated via virtual visits, what are sort of important decision-making and important points, and then what are the softer skills that are necessary and involved in a telemedicine visit that we teach in person that need to be translated and sort of codified in a virtual visit. So we're working on a formal curriculum for that, and it's not something that's been implemented yet, but I think it's something that we will do soon. And I think it's something that people should be asking about and looking for, because it's just a skill that you're going to need as a clinician. One of the platforms that we're hoping that we'll be able to teach this in is in these community health centers. We've been applying for grants and trying to figure out how to set this up to be able to do more work within local healthcare, local community health centers, and hoping that that will be a way that we can both have opportunities to work within the community, understand more community health provision, and also apply telemedicine. That's one of the things that we're working on.